Welcome everyone to our virtual Memory Care Symposium, What You Need to Know. Thanks for joining us today. My name is Patricia Gustin. I'm the Executive Director of Emerald Court at Kisco Senior Living Community. The professionals who are with us today are people who we work with closely and have been a great resource to our community. Our keynote speakers and panelists are part of the Emerald Court family, and we will continue to be a resource to you and to your families. I would like to introduce Ben Allen from Alzheimer's of Orange County, Dr. Reza Dolouei, general practitioner who specializes in geriatrics, Randall Lonoza, National Director of Kisco's Dining Services, and with him are John Williams and Lauren Merritt from Crandall Corporate Dietitians, and Libby Hash, Kisco's National Director of Wellness and Memory Care. For many years, Emerald Court was known for our large independent living community. But as the years pass and as our residents age in place, higher levels of care and services are needed. Our assisted living grew in the last few years with the addition of the Sapphire building. And in a few weeks, we will be opening our new memory care neighborhood, Connections. Being that Connections is new to Emerald Court, we want you to have the opportunity to ask questions and learn more than just about our beautiful community, our memory care program, and Kisco's 5-star hospitality, but also about dementia and the resources available in our community, some helpful information from experts in our industry, and possibly some tips for a healthier brain and body. I hope you enjoy our segment. I will now turn it over to Eric, our moderator. He is our Business Development Director.
Going to share with us the most important thing about making connections with loved ones who are dealing with dementia. Ben, go ahead. Thank you.
Thank you, Eric. And Patricia, you've got a slide there you can show. I'll just introduce a little bit of my background. In addition to working in the field of community education, I'm a family caregiver myself. My wife, Judy, was diagnosed with probable Alzheimer's almost 12 years ago. And for the last 7 years, she's been in a long-term care facility where she has done really well. And the picture that we're showing now was taken there roughly a year after we had moved her to that facility. And on that particular day, there was live music in the community. And that's really the best way that Judy and I connect. She loves music, especially when there's a live musician. And when she was able, I would get her up on her feet and we would move a little bit to the music and could just feel her spirit being uplifted and engaged. And she totally understood that what we were doing was an expression of our relationship. Despite the fact that our relationship had changed dramatically over the preceding years, we still had that point of connection. Now, today, Judy can no longer walk. She's mostly nonverbal, and yet she's really very content. She's comfortable, and sometimes she's very happy. And I still see the smile that we see here. So when those times that we have time together, I play some music from my phone. I bring a Bluetooth speaker and I sing along, and it's a beautiful time. And I can, again, just see her being filled up and relaxing into the music. Music is a great way to connect, as is art. And that's part of the work that I do in community education, is helping people with dementia use art. And all of the creative expressive arts are just great ways to get people engaged, help them to be contentedly engaged and producing something, in the case of art, as a very positive experience for everyone, not just for the artist, but also for the person who's facilitating that activity, and for family members who, whether they are participating in art sessions or later seeing the product of their loved one's art, It's really a powerful thing. But just a few things that I've learned over the years about relating to Judy or to anyone who has any kind of dementia, Alzheimer's or another form of dementia. I have to learn to see the world differently. Patricia, if you can go to my next slide. I use this map that was developed as a way to show the relationship of the continents more representative of their actual size. And it's just a different way of looking at the world. And for me, this is a great example that we have to learn to see the world the way our loved ones do, which is different. You know, we have decades of relationship with our loved ones, and we assume that they are going to communicate, they're going to receive my communication the same way that we always have. But unfortunately, the effects of the disease are changing things. And if I keep doing the same thing over and over, and it's not working, all I'm going to do is cause frustration on the part of my loved one and for myself. And it just isn't effective. So I learned to see the world the way they do. And there's lots of impacts of the disease. And Dr. Reza will probably talk more about that in a little bit. So I won't belabor that. But adjusting to the differences, and there are some significant differences, especially in how we express ourselves, how we can express ourselves more effectively. So Patricia, let's go to the next slide. One of the things that I've learned is that communication is first and foremost through our body language, which is not just our posture, but it's also our facial expressions and our gestures. All of that communicates more powerfully than our words. We have a tendency to depend on our words and assume that people know what we mean. But in reality, we can communicate better, especially as our loved ones' language capability is declining. My body language communicates. My tone of voice communicates more than my words. And so I have to keep that in mind. I have to learn, and it's not easy. It took me years to figure it out. But I can make adjustments, and especially when I listen for emotions, that becomes more important, and I can make a better connection with my loved one by paying attention to emotions. So all of that brings me to some of the services that we offer to residents of Orange County. The organization that I work for, Alzheimer's Orange County, has a number of programs and services. And Patricia, if you'll go to the next slide. This is an image of Judy with a staff member, and she connects, but it's primarily the visual, especially facial expressions. Unfortunately, her disease has impacted the way her brain interprets what her eyes are taking in. But if someone gets close enough that she can really see them, there's a connection and that smile again. Next slide, Patricia. I just want to encourage you to connect with our organization. Our helpline can offer lots of support, especially when you're struggling with some difficult challenges. And there are lots of challenges as we walk this road. Give our helpline a call, and they can help you walk through those and develop some alternative strategies for difficult situations, and also connect you with our educational programs. We are doing a lot of programs even now during the isolation of the pandemic. We do Facebook Live programs every Tuesday morning. So you can find us on Facebook, and you can like our page, and you'll get notified about programs that are coming up. We have webinars. We have programs in Spanish and in Korean and Vietnamese, and we're working with the Farsi speaking community. So lots going on that we would like to offer. And almost all of the services that we offer are free to families. So we really want to connect with you and provide some additional support. Our website is a great resource, alzoc.org. You can even see our latest art gallery of paintings that have been created by artists in our Memories in the Making program. So I'll pause there and let the next speaker take over. If you want to go to our directly to our website, you can use your smartphone, point your camera at the QR code here, and that'll bring up a link to show you all of our programs and services. So thank you for being here today. Patricia, thank you for the opportunity to talk to the audience today.
Thank you, Ben, so much. Thank you for sharing your experience and giving us some practical ways to connect with our loved ones, being able to try to see things the way that they do and focus more on what our body is saying than what our words are communicating at times. So thank you for sharing that. Our next guest speaker is Dr. Reza Dolouei. Dr. Dolouei is a family medicine physician who specializes in geriatric care. Dr. Dolouei cares for seniors in multiple settings, including hospitals, skilled nursing facilities, in their homes, as well as in assisted living communities like ours. Today, Dr. Dolouei is going to share with us what is memory care, how do we recognize it, and also how is memory care currently treated. So Dr. Reza, thank you.
Hello, everyone. Thank you for the introduction. Before I go to the memory care, I want to say what is dementia. Whenever our brain function declines, and that decline could be not remembering things, not being the self-express, or do the high executive thing like calculation, doing the bills, we call it a dementia. So dementia is a general word. And then we have subtype or different type of dementia. Alzheimer is the most famous one, right? We have Lewy body dementia. We have vascular dementia. We have dementia after Parkinson's disease, especially patients with the end stage Parkinson, they can develop dementia. So that's a dementia. Diagnosis of the dementia in early stage has been difficult because most of the time we say, okay, you know what, this is a memory impairment because of the age. Some memory impairment is age adjustable. We expect our memory to decline, but in what level? And that what level is coming by different testing to see if that level of decline is normal for that age or not. I just saw a 98-year-old female who fell down, sharp as sharper than me, very with it, knows where she is, what she's doing, paying all her bills herself. So definitely that definition of decline in brain function is important. So family member occasionally, they miss the early onset of dementia because they live with them, they don't see those signs. So following with the doctors, doing those tests is always recommended. We recommend as a geriatrician to check memory, once a year to make sure those decline be diagnosed earlier stage. And then we come into the treatment plan. There's two ways of the treatment, big category. One is lifestyle modification, which is including entertainment, social contact, diet, exercise, hang out with the colleagues. And the other part is medication. I will leave the medication on the side. Let's just focus on the lifestyle modification. Either medication or lifestyle medication, they has shown decrease and slowing down the progress of this disease. A place like memory care unit would help our resident. We just take them as a family member. We individualize the care. Everybody has a different background. Usually at age 70, 80 years of history comes to us. So we want to get to know them very well, know what they like and what they don't like, knows what their trigger, the behavior, like agitation, just a simple agitation or insomnia, and diagnose them and do the plan of care based on individual person. Definitely a support of the meal You have no idea how many times I see the patient with memory impairment, they live alone. Even in the mild to moderate stages, they have no food. Okay, how many times we go to our parents' house and open the fridge or open the drawer cabinet to see if they are taking their food, if they have the good food, or is it the expired food, or do they take their medication? So those things can be definitely managed for memory care, the memory care unit. The goal of our patient, when they get indicated, when they get to the point their safety is in danger, they need memory care. You know, safety is always first. And safety means somebody scammed them, take their social security away, or are they safe to walk by themselves? Are they have enough food? I have a 93 years old gentleman. It's Emerald Court. He came from New York. They found him on the floor because he used to go out and eat every single day. After pandemic, everything was locked down. There was no food. So they found him on the floor 3 days with no food. He ended up in a hospital. He's doing great. Those are the things that can be handled at a memory care unit. The other part of the medication, definitely there are some medication that might slow down the progress of disease. Just slowing down is not gonna reverse anything. We base on the patients and so many other factors, including their age, they might get of the benefit of those medication. I believe Alzheimer, or let's just make it as a big picture, dementia, is something is has missed on so many patients. The diagnosis is not appropriate. A patient were not appropriately evaluated. So, and their safety is a concern. Somebody should advocate for them. Okay, the brain function is not as good they used to, and that's their family, and absolutely our job, all of us, to advocate for our patient and based on their capacity. In the memory care, we want our family to be involved because involvement of their family is create a small little family in that that unit or that building. Okay, they're gonna spend eat lunch together, breakfast together, dinner together. So that family will bring joy to them. We want to keep them happy. Okay, we don't want our patient to stay in the room and do nothing. We want them to be involved as much as they can, as much as they were not triggered and cause a disturbance to our patient. As Ben said, it's really important to find a niche of each patient and bring that niche to this individual and keep them happy, safe, and healthy.
Thank you, Dr. Dolouei. We appreciate that. All right. Just to let everybody know as well, after we get through all of our guest speakers, we will have an opportunity for questions. We've actually had some family members send in some questions ahead of time, so we'll address those, and then we'll also open it up for more questions. Our next guest speaker is Randall Lonoza. Randall is the National Dining Director for Kisco Senior Living. He's been in the senior living industry for over 13 years. And today, Randall's going to talk to us about the importance of the dining program in the overall programming for a successful memory care connections community. So thanks, Randall.
Thanks, Eric. Audio coming through loud and clear? All right, perfect. Well, hey, look, I'm excited to speak to you all today. I'm a chef by trade. I love cooking. I love food. I love experiences. And I like making memorable experiences whenever we're eating or sharing a meal together. I think something that that Ben shared at the beginning of this panel was about reading body language, and in restaurants and in the dining room, that's important for us to do it in any dining venue that we're serving, right? How many times have you been at a restaurant where you had a great experience and somebody just happened to come over and refill your beverage, or they knew that you were looking for some additional napkins? How did they know that? You know, when I'm in a dining room and I'm kind of reading the room, body language tells a lot. If somebody looks uncomfortable or if they're not touching their food, those are cues that we can pick up on, and those are things that we train our associates to look for, because it is very much that experience. You know, our memory care neighborhoods are called connections. We make a connection with all of our residents. We are looking to have a person-centered approach, getting their preferences and dislikes of food that that they've had over the years, or things that they would want to continue to have. But it is important for us to go on that journey with those residents and to make sure that we're meeting them where they are at that current moment. So, we want to create that memorable experience, and we want to make that an emotional connection with our food. One of the ways that we do that, and we want to engage all the senses within our connections neighborhoods. There's verbal, there's visual, we can read things, we eat with our eyes, we look at garnishes on plates, but we also like to focus around aromatics, whether that's fresh herbs or fresh sauteed garlic that's occurring. We actually put into our connections kitchen an induction top burner that, if you know what induction is, if you put a pan there, it heats the pan, but there's no flames on it. And it's a lot safer than having an open flame in the kitchen. But we want to finish off items there. We're not saying we're going to cook full meals there, but if we finish something off with fresh herbs and spices and that aroma is in the room, I know that the residents that are there for their meals, just their body language is going to tell me, oh, I like that, smells good, or no, thank you, I'll pass. Yes, we can have menus and we can let our residents choose there, but it's just as important to have display plates, to have the food presented, to have it garnished, show that to the residents. We're looking at different contrasting plates just to help with depth perception. We also purposefully chose square tables versus round tables to have a more identifiable space to give the residents more of that sense of control and belonging of where they're sitting at the tables. That's very much important. So, whenever we're talking about our residents and the programming that we're doing, it's not anything special, right? It's that experience. Just like if you're going to a restaurant, you want people to be attentive to you, look at your needs, and provide something that's not only going to taste good and be exciting, but that's also going to take care of the nutritional value that we're looking for as well too. So with that being said, I do want to touch base on the partnership that we've made with Crandall Corporate Dietitians. They come to our communities every quarter and provide quality assurance audits. So they're looking at safety and sanitation. Obviously, that's really important. Everybody is very aware of hand washing and disinfecting. That's something that we've always done, but I'm glad that everybody else is getting educated around that. So they provide quarterly audits there. They look at our meal service. They look at how we're serving our residents, give us feedback. They provide nutritional assessments. And then they also look at our menus, and our menus are dietitian approved, so they'll sign off on all those menus. But I was hoping to make an introduction with them. So they're going to talk about some brain foods. I know Patricia has a nice colorful photo to show us as well too. So if you want to line that up, Patricia, we'll take a look. But I would like to introduce John Williams, who's the Chief Operating Officer from Crandall Corporate Dietitians, and also Lauren. She's a registered dietitian and a menu development specialist. So I'm going to kind of just pass it over to them. We're going to have some time at the end for other questions as well too, but I just want to introduce our partnership with Crandall and their team. Thanks, Eric.
Thanks, Randall. What a great welcome to us. We really appreciate it, and we appreciate your partnership too. As Randall said, we do have local dietitians that work with the communities, and then we also work at a corporate level, with Randall and the rest of the Kisco team, and it's just been, a great partnership moving forward. And so what we want to talk today, and I'm going to ask Lauren to speak specifically to which foods we should incorporate into our diet to help with memory care and just with overall brain health. There is one thing I wanted to read just before we got started, because I think food is a little bit different now. I think the old philosophy was restrict, where now we're identifying foods that we could eat a little bit more of to help our brains. And we actually are finding when we restrict a lot of foods, or when it becomes a diet that residents aren't used to, it can actually cause a negative effect. So I love this saying, so I'll just go ahead and read this and then we'll pass some time off to Lauren. Healthy eating is a way of life. It's so important to establish routines that are simple, realistically, and ultimately livable. And that's from Arthur Eggleston. And what we do is small changes over a long period of time, and their lifestyle changes. And I think when you hear the foods that we'd want to incorporate, I think you'll be excited about these foods. So
absolutely. I hope everyone's already eaten lunch, because I get hungry just even talking about a lot of these things. We know them. We've heard all of these things before. As John said, they are simple things, things that are promoting brain health and just overall healthy living. increasing whole grains, fiber, making those easy swaps, starting to decrease the processed foods. Now we all have our favorites. It's not saying this is an all or nothing approach, but our dietitians will be taking a look at that and checking out variety. Increasing good fats, and this can be a variety of things such as fish, different types of oils, nuts, seeds. It could even be dairy alternatives. If you have a loved one who maybe can't handle dairy as well, that's a really good way to help decrease saturated fat in our diet. And by adding in all of these other things, sometimes there's not as much room on the plate for all the red meats and the cured meats. Now, I know I personally love a little bit of bacon every now and then, but there are alternatives out there. Offering a wide variety of colors, this could be from fruits, vegetables. Love them for their antioxidant properties and the fiber, the vitamins and minerals that they all provide. You see some dark chocolate on this picture. Dark chocolate is known to help improve brain health. Let's eat a little bit of it every night. I'm on board for that one. And lastly, let's think about the cooking techniques. And I know Randall will be taking care of this in the kitchen. Think of some lighter techniques, throwing them in, broiling, baking, steaming, and that just adds variety to the food as well, instead of always getting the same sauteed or fried item. Just really simple changes and swaps that we can do.
Yeah. And we also embrace too, if a resident is used to, or loved one's used to going to McDonald's or something like those, I don't think that we could totally eliminate that from their diet, because that's what they're used to. And I think part of our goal is to make them feel comfortable in the community and that we are listening to them. So I think that's important. I know my grandmother would want to go out and go to Denny's or different places, and so that's where we would go with her once in a while, not all the time. When we do come in as dietitians, we do help to assess the menus, and we do help to look at how we can enhance the overall nutritional content. And Randall hit on that when he was talking about our partnership. So we'll sit and we'll look at the menus and we'll give feedback. Maybe we could adjust this, or like Lauren was saying, maybe we could reduce some of our prepared items, which I know Kisco is really known for your famous, for home cooked meals and just trying to really accent the flavors. So I think you guys are already doing that at a level that's really good for residents, and let's keep doing that. We do look at satisfaction surveys too, not only from the resident, but from family members. So what's the feedback that we're getting from, on food? Food's so important. I think food really, affects everybody. We're all interested in food. So it's really good to get that feedback and then to make changes or recommend changes in the community if needed. And then I wanted to share with you, there's a document called the New Dining Practice Standards. I think it came out in August of 2009. But it does talk a lot about, resident choice and about trying to stay away from really therapeutic diets. Again, when we really restrict the diet, we do see, additional weight loss, and we could even see pressure injuries, which is the breakdown in the skin. And so our main goal is to keep that resident healthy. And from a nutritional standpoint, weights are definitely, part of that. We want to see a very stable weight trend. And that shows that nutritionally that they're good. Now we want to take do some lab tests to see if we need to provide supplements, which we'll talk about a little bit later. But overall, their weight is going to be the #1 indicator. And then we do, verify residents' diets when we're in their community. So we'll go and we'll look at a resident's chart and then, work with the kitchen, and we'll make sure that diet matches up and that we're all on the same page. So really, we're just an extension of what Kisco Dining, in the hospitality that they offer as the, as a resident family or a loved one.
Thanks, John. I appreciate that. And we really do appreciate the partnership. Look, we want the resources local to all of our communities. We want those dietitians to be physically present. It's really important to actually go and experience our dining programs. And when we initially made this partnership with Crandall, we actually asked all of the dietitians to come and have a meal with us and share lunch. The pandemic happened, so we had to close our dining rooms, but hopefully one day we'll be able to share that meal in person again. So appreciate it, John. Thank you very much. Eric, I think we're going over back to you.
Absolutely. Yeah, thank you guys also for your partnership. One of the privileges of working for Kisco is we get to enjoy meals here as well. And it's nice to know that the delicious food I'm eating is also healthy for me. So the extra 5 pounds I gained is healthy 5 pounds for sure. All right, so our next speaker is Libby Hash. And Libby, her passion is wellness and memory care. So Libby has been with us in the senior living industry for over 25 years, really helped with programming development in our communities. And she's actually been with Kisco for over 16 years. So today, Libby will be discussing with us how specifically Emerald Court approaches memory care and how we do that through our connections community and the programs involved. So go ahead, Libby.
Great, thanks, Eric. Thank you so much for allowing me to be a part of this. I'm so excited. As Eric alluded to, memory care has long since been my passion, and that's where my heart lives, and that's where I enjoy putting a lot of my energy. So being able to be with Kisco and be able to use my passion to help others and to be able to create communities where residents and families can feel safe and comfortable has truly been a dream come true for me. So I'm very excited to support Patricia and the Emerald Court team in opening up connections in their community. But I wanted to kind of talk to you about some things that Ben talked about that really resonate with me when I am helping support the communities. And that is that it's the little things. It's right, Ben, it's the little things, and it's those moments. And how do you capture those moments, and how do you notice those moments? And what differentiates connections from other memory care communities that might be around in the area are several things. One of them is that we create a dementia-enabled environment that provides a safe environment, definitely, but it also provides a secure space with ease of access and autonomous exploration for residents and individuals to be able to live in their space and be comfortable, confident, and as Ben alluded to, you know, those moments of joy that we try to make sure that we stock the areas for moments of joy and set them up for success. So how do we do that? How do you create that environment? What makes us different? One of the things that makes us different is how we connect with, hence the connections of the name of the program, how we connect with residents, and not just residents, but resident family members to create this experience for each individual that comes through our doors. And that starts before you ever move into the community. And that's with finding out who you are. We develop what we call roadmaps for every individual that lives in our community. And that roadmap goes all the way back to where they were born, their upbringing, experiences of culture, where they went to school, where they married, what was their career. But we also ask some really pointed, important questions that I think sometimes are even more important than what their likes are and what their history is. And we dig into what don't you like? To Randall's point earlier, you know, food's really important at every point and aspect of our life. And if you live in a senior living community and you're in a connections program and you're unable to verbally articulate that you don't like something or that you would prefer not to eat it, it's our job to know that before it ever lands on your plate and put you in the position where you have to turn away from it. And we do that by creating these roadmaps, these very detailed explorations of what the individual's life was prior to coming to us and what the hopes and dreams of the family members are for what their life and their journey is going to be like from the point they enter our doors until the end of their journey with us. So one of the things that I think that brings it all together and allows us to bring associates that do such a good job is something that we require, and it's called the Virtual Dementia Tour. And we require associates that work in our memory care communities to experience the Virtual Dementia Tour. And this allows them, it's a sensory experience that allows the associates to spend but just a few minutes of what it would be like to walk in the shoes of someone with dementia. And the difficulties and challenges that they face performing sometimes just the simplest tasks. And the reason that we do this is because before we start the rest of their training, we want them to understand what we're training them for and what their job is going to be. And their job is going to be that they are the ones that are going to adapt to the environment around them, not the individuals living in our connections communities. And I think that's the leg up that we have on our competitors and on other senior living is the vision and the view that we look through is that we understand and we're looking to adapt our behaviors to better suit the needs of the people living in our communities. And I get the distinct pleasure of going into these communities like Patricia's and spending several days with the team and going over the training and the important things that they need to know to be the best of the best in their jobs. And one of those focuses on engagement. As Randall keeps them happy with food, it's my job to make sure that they keep them happy and being engaged. And back to the roadmap, I need to know what you like, what your interests are, what you're passionate about before you ever step through the door so that I am ready when you come in to engage you and keep you happy. If it was Ben's wife, I would know that it would be music. Ben would tell me she connects with music. Libby, that's what you need. I would make sure that I would not only know that she likes music, but I would ask Ben, what kind of music, Ben? What was her favorite song? What does she dance to? What does she not like? You know, what do you think would be memorable? It's something that's required for us to be able to form that relationship with residents and resident family members to be able to provide that high level of engagement. And one of the things that is really important to remember when you're in a communal living setting is that one of the benefits is that as the dementia progresses and the journey goes on and the abilities decrease, or they become less likely to be able to participate in their passions and their interests at the level they did before, we're there to fix that. We can adapt the environment, or we can provide them with the adaptive tools they need to still be effective in what they do. They can continue to paint, they can continue to dance, they can continue to participate in physical activities with the support and training of our teams. And I think that's a huge, that's to look at the opportunity to be able to continue to do what you love for as long as you're able to do it. That's pretty much what life is all about. And that's what we talk about at Kisco with our Art of Living Well program. It's defined as being able to do what's important to you for as long as you're able to do it, and as long as you continue to live. And that's really what myself and the team that supports me and the team that I support, that's what we do when we go into a community, and that's what we arm them with to be able to be the best that they can be. And I think that it's really important to note on Connections that we create that safe and supportive environment, but it really truly reflects the person's characteristics and personality and preferences. And that allows the family to worry less and enjoy more when they come to visit their loved ones. And if I've done my job correctly, that's exactly what the feeling will be when you visit one of our communities. Thank you, Eric.
Thank you, Libby. We really appreciate your support. I know, you know, one of our values is to enhance the lifestyle of our residents. And we do that through creatively designed programs. So we appreciate your support in being able to provide that for our residents.
Thank you.
All right, so now what we're going to do is we're going to take a moment and we're going to give some questions. So these are questions that were given to us from family members prior to this discussion. So we're going to go through those questions. We've got some questions for each one of our guest speakers. And then if time allows, which hopefully it will, we'll get to any questions that our current audience has. All right, so our first question, Ben, this one's actually going to be for you. What do you consider to be the most important benefit for seniors with memory care challenges doing creative activities in a group setting as opposed to doing it by themselves at home?
Great question. Thanks, Eric. I know from watching Judy, when she first moved into the facility, she was very reluctant to participate in activities, but as she got comfortable, the activities just drew her in. And even when she was no longer able to walk, just being in the room when they were doing exercises, group exercises, that just energized her. She'd be smiling and she'd be clapping. She wouldn't be following any guidance, but she was enjoying the experience of having other people around, no matter what the activity was. It just got her energized. And I think that's the benefit of any kind of group, just like, you know, we talk about lifestyle changes and ensuring that we're physically active. It's always better to have a partner. It helps you with, you know, to stay motivated to keep to the schedule and get out and do whatever it is, whether it's walking or playing some sport. Doing it with other people just enhances the experience. I've just seen that so many times for Judy. Just great experience doing things that I never thought she would do. Or that she cared about. Just because other people were enjoying it, she was feeding on that energy. So that's it.
And Eric, if I could, I just want to say that Ben, having witnessed this, it's a pretty remarkable thing to witness when you have somebody, especially when a family member says, you know, oh, my mom or my dad would never do that, or my wife would never do that. Being able to see that it's pretty remarkable. But if there's one thing that we've learned over the course of the last year is that none of us does well with isolation. We've learned very quickly that it's really hard to be separated from our loved ones and to be separated from people in general. And I think that lends itself to what Ben was saying, is that just having those people around you and setting yourself up to be an environment that makes you comfortable, because you can all participate equally and there's no sense of failure, or there's no intimidation of being in a big space that you can't fit into. You fit very well into your environment. I think that lends itself to the increased opportunities of socialization and encourages them to want to come. As you said, it draws you in because it looks like so much fun, you just can't resist. And that socialization helps with depression. It helps increase appetite. There's so many positive things that come from social connectivity that can be provided in that social setting. So absolutely.
Yeah, thank you both for sharing that. It actually, as you were sharing that, Ben, it reminded me of one of our residents recently. She was getting on the elevator after lunch, and I said, how are you? How's your day going? And how was lunch? And she looks at me, she says, well, I like to eat, but I love to socialize. And that's what it was all about for her. It wasn't about just eating. It was about connecting with others while she was eating. And I think that's so true with all that our residents do within the community, is being able to do it while connecting to others. So thank you for sharing that. All right, let's move on to the next question. This question is for you, Dr. Dolouei. This one, it says, I have an older parent who is definitely denying the signs of memory loss or brain changes. How can I, as the child, have the best conversation with them to get them on board with finding help?
Okay. With dementia, we should understand the function of the brain is not normal, right, for a patient's age. So I would recommend definitely follow up with a physician who are specialized in dementia and also Alzheimer, will definitely help the patient. I have seen two groups of patients. Some patients, they are aware their memory goes down. This is an earlier stage. They get frustrated easily. They say it, hey doctor, I cannot remember things I could remember. I have a hard time to find a word to express my emotion or what I want to say. Those populations they accept it gradually. But there are some groups that are always in denial. And always they make a story of the things is happening, and then the thing they have missed. Oh, you forgot to take your medication. Yes, I just got busy on the phone. And this is just keep going and keep going and keep going without taking medication. So they always have some reason. Those are the difficult patients. Those are the patients who get benefits of the frequent physician visits, evaluation. Okay, when we do the MOCA test, a slums test, the different type of a test we do for memory, we evaluate what part of the memory is declining, and we can work through that. One of my advices to the family member of people, who are the caretaker of the dementia, never fight with the patient. Just if you want to help the patient find their triggers and avoid those triggers, you're not going to correct things. The thing is broken, and the way to the point of not fixation, we just need to walk with them. That put a lot of burden our caretaker or caregiver for our, for a patient with dementia. The Alzheimer's Association has a group therapy for, caregiver burden. This is significant and costly, not only like mentally and physically, also financially for both parties. So I would definitely recommend those patients to come see the physician who is specialized in memory care. Usually two groups of physicians, neurologists and geriatricians in the area. They can reach out, and based on which part of the brain function is missing, we can help them and educate the people. And some of them could be misdiagnosis. Depression can present as early sign of dementia. So I think the family member, when the patient start getting dementia, what I have seen so many times, so many patients, they start arguing. Wife and husband start arguing. Kids and the parents start arguing a lot. That's the time you should back up and just bring them to the physician who can evaluate the patient and make a decision. Maybe they are depressed, and maybe they just don't want to accept. So many times I've been in a patient room, I say, hey, Mrs. So-and-so or Mr. So-and-so, you have unfortunately a cancer. Just not like that. Just talk to about the bad news. The first thing they said, no, I don't believe that. So denial is a first step of any type of delivering bad news or accept a disability or anything related that can change the human's life. So connection with the physician and the caretaker is the main key to provide the best care to our senior citizen with dementia.
Great, thank you for sharing that. So in other words, give you a call. You can help with that conversation with the loved one. You can also give Ben a call with the Alzheimer's of Orange County, that they have resources that they can also come along and support families. Actually, recently I was talking to somebody who is a professional and is their family member that they were struggling with having that conversation and just looking for resources. And for me, it was really nice to be able to give them a resource with the Alzheimer's of Orange County. So I'm super thankful for that. Dr. Dolouei, thank you for sharing that. Okay, our next question. This question is for Crandall, our dietitian, not Randall, but Crandall. It says, we have been recommended to take all these vitamins and supplement pills. Do I still need healthy food if I'm already taking these supplements?
Absolutely. I'll go ahead and take this. It's a really good question. We live in a time where, we want almost kind of a quick fix. We want one pill to help us deal with everything. But we would actually recommend that food first, supplements second. Supplements are actually just that to one's diet, supplemental. Vitamins and minerals should be tailored to one's specific needs, if they're even needed at all. And our bodies, as we age, kind of don't absorb every vitamin and mineral that we're eating to 100% capacity just from food alone. So if we're getting a healthy, balanced diet, as is from the meal plan we discussed earlier, let's say one person might need supplement A. Okay, that's fine for one person, supplement B for another person. Those things are just to fill in the gaps that food's not providing as we age.
All right, thank you. All right, let's move to our next question. This question is for Libby, and this is in regards to memory care situations. This family member asked, are memory care parts of the community still engaging for seniors with memory care needs? Are the more engaging parts of the communities more where the active, independent seniors are living?
It's a great question. And the answer is yes, and they're built specifically for that purpose. When we were, before we opened the doors of Connections here at Emerald Court, I get the pleasure of working with Patricia and the team to go over what would they like to see in the Connections environment. And we have a working list of things that we know for a fact will go in there that are stimulating and engaging. And not only are they in the community and put out, but they're not locked behind a door or in a cabinet or anything like that. We set the community up for what we call autonomous engagement, much like all of your homes are right now, so that as you walk through the room and you see something and it catches your eye or catches your attention, you might be so inclined to go over and partake in that, whether it's a puzzle, whether it is a broom and a dustpan if you like to clean or if you like to sweep, whether it is an active movement of some kind, so that you're getting exercise, whether it's a stability ball that you're working with or something. So the environment is perfectly set up so that as you're going through, regardless of if it's in a specific communal area or the hallway or off to the side of the kitchen or anything, it is specifically set up to draw the attention of the individuals living in that environment to support the needs and interests that we talked about earlier, to have that opportunity for autonomous engagement. Because I bet if we ask everybody on this call right now, everybody on this call would have a different answer, or not the exact same answer at least, for when they like to be active or when they like to do something. We're going to have some morning people, we're going to have some evening people, we're going to have some people that do better in the middle of the day. So we recognize and appreciate that we're all different, and we set the environments up so that you don't have to be up at 7 o'clock every morning, or you don't have to be at the fitness class every day just at 10 o'clock in order to be engaged and active. We set the community up specifically so that it's a smaller, more contained environment with higher level of engagement than what you would get in the bigger environment with less opportunity for engagement. Thanks,
right.
Eric.
Yeah, thank you for sharing that, Libby. All right, looks like we have a few more minutes. So I wanted to take this opportunity to give our audience some room and some time if you have any questions. So just so we have clarity, Patricia, they can just go ahead and unmute at this point and ask the question, correct? All right.
I have a question. With COVID, have there been any link now with Alzheimer's being either, or dementia being more progressive or enhanced?
I can answer that question. Definitely. Unfortunately, since pandemic has started and our patients were, even patients were just with a mild to moderate dementia, they were not able to see their loved one. The level of the decline has been, the speed of decline got faster. Part of it is because the patients are developed depression, isolation. These are the two things we should avoid in any patient with a memory impairment. Imagine we have 10 brain cells when we come to this world. By dementia, for any reason, these are coming to the very little, like maybe 3 to 4 when we got diagnosed. The patient, if you lose one more, it's not one more, it's just a lot more. You already lost 6, 7 brain cells, and when you lose the next one, you decline significantly. And our point in dementia, we try to make sure our patient, they don't get to this breaking point, because when they get to breaking point, it's not gonna slowly drop and decline. They just fall out of the cliff, unfortunately. Definitely. The number of usage of antipsychotic and benzodiazepine went up since pandemic in all the patients with dementia and Alzheimer.
Thank you. Maybe, I just don't want it to seem like stupid, but once that decline goes down, very difficult for it to be made up, I'm assuming.
Exactly. One of the best thing in kind of a memory care unit or people they work with, the goals of the people, the providers, the healthcare, dietitian, entertainment, the whole point is just to slow down the progress, because when it's progress, if it's not a depression, if it's not a hypothyroidism, if it's not a urinary tract infection, it's hard for them. When you lose, unfortunately. That's correct. And that's the benefit of the memory units are. They try to avoid these declines. So the goal is to keep the patient on the level they are. Definitely they're gonna decline down the roads, but we are trying to slow down that progression.
Elizabeth, thank you for asking that question. All right, does anyone else have a question?
Eric, I see that in a chat box. They said, will we continue to test all the residents and associates for COVID? If somebody can.
Yeah, I think what that's addressing is one of our goals here at Emerald Court has keep our residents connected as much as possible. And one of the ways that we've been able to do that is by testing our residents twice a week, as well as our staff, all of our staff, our community management team, as well as associates. And by doing so, we've been able to really keep our residents safe and our staff safe to help them keep connected. And although our community has an extremely high compliance right now with the vaccine, we will still continue to test our residents weekly for COVID.
Correct. We will continue to test our residents and staff on a weekly basis. Thank you, Kathleen, for your comments.
I have a question.
Sure.
Could you briefly explain how if your loved one is already at Emerald Court in assisted living, what would we see as the family as a difference between moving into the memory care as opposed to her assisted living now?
I can answer that question. Currently in assisted living, our residents are able to ask for help and such, and usually residents in assisted living are able to help themselves and or make choices in the dining room in a wide variety of choices, of menus. In memory care is very different because they're going to be continually be engaged. Our goal is to get them out of their apartment so they can have that socialism that Libby and Ben were talking about earlier, as well as Dr. Dolouei. That's our goal, to really get him out and get him socialized and to encourage them more to be out. While in assisted living, they have the choice of whether they want to stay in or they go out. And usually people that are in assisted living have the wherewithal to make those decisions. In memory care, we assume that it's either not there anymore or limited. So we want to give them the choices yet a little bit more. Let's go. Instead of questioning, would you like to do this? The encouragement would be, come on, let's do this activity. We're having a great activity over here. We're going to have some music. So it's a little bit different in how we do our activities and how we do our engagement in memory care compared to assisted living.
Can I add something too? That's a great question, Larry. You know, we have called ADLs, activity of daily living, which is including bathing, you know, shower, feeding, dressing. When we see a big decline in ADLs and our patient needs queuing to do that, you know, when you see they mismatch their clothes, that's the time the patient needs a lot more queuing to do the proper you know, a way of showering, proper using a toilet, proper using of, you know, transportation. That's the time we need to decide to take them from kind of independent living and put them in a safer environment that patients get more queuing to do their stuff that would potentially make the patient being safer place, eat proper, and engage in the community and in the social activity properly. We call it ADLs, activity of daily living. And if you are on a computer, I assume, so there is a very good chart I would like everybody to take a look at. We call it FAST score, like a FAST, F-A-S-T, which is a functional assessment on a patient with dementia. And that's from stage 1, from very minimal symptoms all the way to 1, 2, 3, 4, 5, 6 ABC and 7 ABC, D, E, F. Just look and say where the mom is or where the dad is or where the loved one is. And that will be a good indication when we should move to the next step, when the patient needs more care and more supervision. In that chart, also compare the level of advanced dementia with the age. Like, for example, if I have a FAST score of 5, my memory is just 10 to 12 years old. And it goes all the way down to 6 months old. You know, that's those patients, they just need to get fed. They cannot swallow very well. They cannot have a solid food, just like a 3, 4, 5, 6 months old baby. And that level will help us to decide who is going to get benefits of memory units.
Okay, so the memory, Patricia and or doctor, in my particular loved one's case, it's a kind of a rapid mental decline, but also a fairly rapid physical decline as well.
Correct.
So
part of the decline in a memory is a physical ability to walk, to stand, to have up. Even in some stages, they cannot even hold their own head. Okay, 3 brain cells needs to do everything. These 3 brain cells gonna focus to provide food, make the basic level of function, heart, lung, kidney running. So we're not gonna take care of the walking. It's not gonna, you know, really take care of the balance. That's the time the decline is so severe, either gradually or rapidly. That's the time to place them in a safer environment.
Okay, thank you so much.
I think, Larry, if I could too, I just wanted to say that I think one of the big differences, to your point, if you already have a loved one in the assisted living environment, the size and setup of memory care is smaller and less intimidating. And as to Dr. Dolouei's point, as as your memory starts to decrease and your physical abilities start to decrease and you need to be more dependent, it's somewhat intimidating to be in an environment where people are not, and it can be intimidating to not be able to keep up pace or not be able to have to be asked for assistance. In the memory care environment, it's an extremely supportive environment where there are like people, and you feel very supported and you feel very encouraged and you feel successful every day in everything that you do, whether you're in dining or whether you're in an activity. Whatever you're doing, you're set up for success. And I think that's where some of the benefit comes from the larger environment going to the smaller environment. That increases the opportunities for success, comfort, and further engagement.
Yeah, Libby, and just to add on to that, you know, if I'm a new resident moving into Emerald Court, just going into the independent living dining venue or the bistro with 60, 70 seats to choose from, I mean, I'm intimidated. I don't know where to sit. I'm trying to go to the host, asking somebody where I should be located. You know, in connections, when you have anywhere from 12 to 16 residents maximum, it really takes a lot of the intimidation away. It's a more intimate setting. We start to learn the resident preferences and the unique differences to that individual. And I just feel like it's a much more comfortable environment, and it's not, like you said, it's not so large to where there's a lot of intimidation occurring, and it is a much safer, you know, and a more comforting environment than perhaps like a very large.
Sí. De hecho, Oscar, te lo voy a llevar. Que vayamos con esta
Thank you very much, Libby and Randall both. Yeah, my mom.
Vamos a probar si no quieres salir. ¿Ya acabaste? ¿Ya acabaste, papá? Ya. Ahora, ¿quieres salir?
It's just a quick reminder, try to be on mute unless you are asking a question.
So the doctor mentioned a kind of like an assessment is like, you know, beginning of memory loss and progressed. How can we get that assessment?
Okay, you know, when we are concerned about the memory impairment, there are a couple of things we do. First of all, we make sure there is no other diseases or diagnoses act like dementia. The famous one is depression, vitamin B12 deficiency, hypothyroidism, and brain tumors, right? So we do this stuff. And imagine everything's come back negative. Now we say, okay, the patient has a memory impairment. This is just like 35 to 45 minutes test. I usually do in my office a MOCA test, which is a Montreal Cognitive test or a SLUMS test. So what we do, we say to the patient, we do this test, which is a 1 page, it's 30 scores, more than 27 is normal. And we see where the patients are lacking. Is it the executive function? Is it the language? Is it the short-term memory? Is there the connection between things? So it's a test, basically. And that's the easy one. There is a 4 hours test, which is doing a neuropsychologist does, which we can arrange that use 4 hours. And that's a lot more details and depends on the age. If my patient is 65 and coming with dementia, I'll do all this, but I send them to the neuropsychologist because he's too young. But if the patient is 80 plus, I don't bother that 4 hours frustrating test because she's gonna fail a lot of it. And you know, we are not here to hurt anybody. We're just here to diagnose them properly and treat them properly.
Thank you.
Are there any other questions for today? Thank you for the questions. So if there are no other questions, we will go ahead and end the day. We would like to thank all of our panelists, our experts in this industry as well. Thank you so much for being here. I'm also going to put something on view right now that is some information about Emerald Court and how to get a hold of us. If you need any help from us, you have family members or friends who you may need to transfer here, we do have some information for you. And if you'd like to get more information, here is some information here that you can see. And Emerald Court. There's our phone number there and our email address for more information, as well as our website. As soon as this part goes off, let me view this on view on full screen. There we go. Can anyone see that? live@emeraldcourt.com. You can see us on our website. Also send us an email, give us a call. You can ask for myself, Patricia Gustin, or Eric, Cassia, and Robin, our sales directors who can help you. So give us a call if you have any questions, any comments. Thank you again to Ben Allen, Randall Lonoza, Dr. Reza Dolouei, John Williams, and Lauren Merritt, as well as Libby Hash. Thank you very much. Thank you everyone for coming in today. We really appreciate you for being here.
Thanks, Patricia.
Have a
Thank
wonderful
you.
day,
Thanks,
everyone.
Patricia.
Bye-bye.
Bye-bye.
Thank you, everyone. Bye-bye.